of Taylorville. Now I'm sitting down with Mamie Campbell from the Pana Community Hospital. She's the coordinator to the Bridge to Home program. How are you doing today, Mamie?
I'm great. How are you?
I'm doing well. So you sound great on our end. We got her over the phone, and we're very interested about the Bridge to Home program, what it entails, what it's all about, and can you give us a little insight about all this?
Yeah, the Bridge to Home program is a post-acute rehabilitation service here within the Pana Community Hospital. We see patients with a variety of diagnoses, special needs, and really what it is just a short-term um, post-acute hospitalization. If the patient's not ready to go home, say they need a little bit more assistance than what they were, they're not quite as independent as they were, maybe some IV antibiotics, we're here for that. We're here with doctors within reach. It's kind of, a lot of patients prefer to come here versus going to a long-term care facility or a nursing home. We have a huge um, advantage to having the doctors right here in our facility if the need would arise, to giving a little bit more reassurance for that.
Perfect. Okay. So this is really going to benefit some people. And how do you know if you are qualified to be given a Bridge to Home?
Some qualifications, really Medicare is the most with the requirements as far as you got to have a 3 midnight acute care stay with the same diagnosis that qualifies you for the Medicare stay. And then some private commercial companies with insurance offer some acute care. I will say that insurance dictates the world when it comes to how much they allow us to do, but there are processes that we can cover commercial plans as well as the Medicare Advantage plans that can come in with no real rhyme or reason as long as the physician's approval and we have the proper documentation.
Sure. So can you explain? Pretty much being on Medicare is one of the main uh, qualifications for this. Is there physical attributes that would allow someone to get into this?
Yeah, it depends on diagnosis. Like acute care for aftercare of a stroke with someone who needs physical therapy or occupational therapy or speech therapy, cardiac, a pacemaker placement, joint replacements. You go in for a knee or a hip and need some extra therapy. Even something as simple as a cellulitis to the lower extremity or upper extremity that limits your ability to take care for yourself at home, normally can require some extra assistance short term, and that's what we're here for.
That's awesome. So there are some opportunities for in-home care, just in case that person may need it.
Yeah, and we have the in home as far as that. We have a Quad County that we normally work close with. That if we get them in the swing bed facility for our Bridge to Home program, we can easily transition them with in home care through Quad County.
Okay, okay. What does that facility kind of look like? Do people go in and see what they're getting themselves into, get to test things out? What does that process look like?
Yeah, we're going to be opening up our facility. We're doing some renovations and going to redo and put a big therapy unit in on the second floor. The Bridge to Home program is actually on the second floor inside the Pana Community Hospital. Um, we are going to do some lunch and learns and really get the word out there, so that patients can come in and tour the facility, see what we offer, see some of our staff. We do have some new faces to the program, so hopefully we can get that out there as well.
Yeah, beautiful. Because at the end of the day, you really just want to get these patients back in their own home, and that's what they want as well.
Yes.
Yeah. What is the average length of stay that patients might need?
Um, in general, my best answer would be it completely depends on the patient. Obviously, because of the world we live in, we have statistics that we have to keep track of. So our average length of stay is about 10 days. But that doesn't say that you come in and you need 30 or you need 50. It doesn't mean that we have to send you home in 10 days. It's all patient specific and what is best for the patient, along with those guidelines of what insurance will let us do as well.
Yeah, totally. And have you heard of any reactions to people that have utilized this, and what has the response been like?
Yeah, so we've been under new management for I don't know, a few weeks now, a couple months maybe, and we have had about 10 recent swing bed bridge to home patients, And I did follow-up calls with them last week, and it was so rewarding to hear the positive things that they said about what Payne Hospital was able to do for them in our Bridge to Home program, as far as the therapy was top notch. The nursing services, they had no complaints, even from the housekeeping services, the rooms being clean and organized. Nutritional services for our dietary department was nothing but praises, good food. So I haven't, the only negative thing I heard was the room temperature. Imagine that. So we do have heated blankets, which is a huge hit with all the patients. And we are going to work on seeing what we can do with the room temperature as far as getting it more controllable.
Well, if room temperature is the only complaint so far, I think you guys are doing pretty well over there, and maybe all those heated blankets are the cause of that. They're complaining about it being too hot or what?
Too
Too
cold.
cold.
Yeah. So I had one lady tell me that she used all of the heated blankets in the warmer, and I said we have ample. So you just let us know if you need more.
All right, well that's great. You guys are ready for the cold folks that come in with the heated blankets. That's really
Yes.
great. And when these folks come in and see this for the first time, what's their reaction? I'm sure they have like feel like they might have a new lease on life or something like that.
Yeah, and the amount of people that don't know what we have. So we come in and we offer it to them, and they're like, "Really? We do this? We've done this?" I was like, "Yeah, we've been here for a while. People just, we just, COVID kind of put everything on hold for like 3 or 4 years. So getting back to the basics and taking care of the patients and letting them know that we are here for them is definitely an eye opener for us as a community and a hospital itself. So when they come in and, they are so thankful that, oh my gosh, I was able to stay in my hometown or my surrounding area. I'm not, in a big hospital in Springfield or Decatur, or I didn't have to go to the nursing home. It's rewarding to know that we can provide that service for our patients.
Totally. And what does setup look like inside the home?
So inside the hospital, they're all, for the most part, private rooms. We do have a couple semi-private, but big bathrooms. We try and do a window view, but also it is inside the hospital. So we are a little bit limited on the second floor with the views, but we just redid all of our rooms. And like I said, we are going to be tearing down a wall and putting a mock apartment kind of in the end of our second floor where we can, train the patients on laundry services and some simple meal preparation and trying to get them more confident to go back into their home environment independently with less assistance.
Totally. A mock apartment complex, like a that sounds really interesting to me. That they can really
Yeah, we're
test
gonna.
out their skills. Can you explain that?
Yeah, so we're gonna hopefully put like a washer and dryer and a microwave and a stove that doesn't really work, but just there for a week and work on their balance and their control and just their independence on how they're going to do tasks with the medical issues that they might have come in with.
Totally. You said that's coming soon.
Yeah, we're hoping to have it up and going maybe by the end of next year.
That's awesome. That's going to be huge. People,
Yeah,
they're wondering, can I open my oven? Can I, carry this basket to the laundry room? Now you can know in front of doctors, safe by their care.
yeah, and especially like patients who maybe they didn't use a walker or a cane before, and now we're trying to teach them how to adapt to that technique while they can take care of their own housekeeping and laundry and self care task at home.
Totally. All right. This has been really great. I've been sitting down with Mamie Campbell from the Pana Community Hospital. She's the coordinator for the Bridge to Home program. It's been a great conversation so far. We're going to take our first short little break here. We'll be right back. You're listening to the WTIM Morning Show. Thank you so much to our live stream sponsors, People's Bank and Trust and Landmark of Taylorville. You are listening to WTIM with Tim, your information station.
Your information station, WTIM. Your information station, WTIM.
Welcome back into WTIM with Tim, your information station. You're listening to the WTIM Morning Show. Thank you so much to our live stream sponsors, People's Bank and Trust and Landmark of Taylorville. Now we'll get right back into it with Mamie Campbell. She's from the Pana Community Hospital, and she works as a coordinator for the Bridge to Home program. They're making it easy for people that have had surgeries or coming back from an illness to really live life on their own terms again. And they're doing that with some great swing bed programs and all of that. Do we still have you, Mamie?
Yes.
Beautiful. You sound great on our end. Now, we're going to keep moving right through our conversation here. We talked a little bit about what kind of people qualified for this care. Now, if someone scheduled a surgery and they're wondering what I'm going to look like after that, can they arrange for this program prior to their surgery?
Yeah, a lot of times patients will have a communication with their doctor, and know that they're not going to have assistance at home. They live independently at home, and they need a small procedure. And as long as the physician approves it and they meet those qualification requirements of the 3 hospitalization and the diagnosis, then yeah, we can arrange it, and we might know that 2 weeks before they're coming into our Bridge to Home program.
Totally. That'll put people's minds at ease and just get one thing off the list that they might be worried about, I bet.
Yeah.
Yeah. So, I mean, we can talk a little bit about if someone has a 3-day hospital stay and things are harder than they expected, can they still request?
Yeah, so say someone goes into the hospital and then medical emergency, they're there for a little bit, or even if they get transferred to, they're in a small hospital like Taylorville, they get transferred to Springfield hospitals, and they go straight home, and things are just a little too hard for them, and they're kind of struggling. They have 30 days that they can actually call us up, a Bridge to Home program, and we can get the doctor on board, their physician on board, and have them entered into the Bridge to Home program for that little extra therapy, that extra care, maybe some IV medicines, maybe that they weren't getting at home that they needed, and we can transition them back home at a higher level of independence where things are easier for them.
Totally. So that's 30 days you have to make that decision. What are some of the activities that you've seen really bring people back into your program here? Is there something that stands out?
A lot of times, IV medications, wound care, they go home and they think they can manage, taking care of their dressings by themselves. And, they get there and it's just too hard, or they can't do it, or it's not healing like they want it to. Just kind of having that medical doctor that, or the hospitalist that rounds every day, see them kind of gives the patient a little bit more of a peace of mind, that they're having a medical professional look at it versus them trying to do it on their own, or they get home and they, stop, things are getting up and down. It's harder to do than what they anticipated. So, they end up getting stuck in the chair, they have a fall. And so then coming back into the Bridge to Home program makes it a little bit easier and gives them peace of mind knowing that we're going to get them a little bit stronger. Anytime you're in a hospital, you get weak. So giving them that extra movement and strengthening to get them independent is really what we're striving for.
Totally. And we're kind of finding out that the Bridge to Home program is kind of unlike a hospital and to where you are transitioning back into your normal life. We already talked about that mock apartment a little bit. And I mean, I'm sure you just see this as, I mean, I'm sure people want to do this more times than not as
Yes.
coming down the way a little bit here. Is that what you're seeing?
Yes, more so than anything. And really we're having a few younger patients because those commercial insurance plans are, they do have some of that availability where they cover some of that more acute, post-acute rehab and IV medicines and wound care, that we are seeing actually the younger population too. So it's a blessing for the community that we have this.
Yeah. Well, if you qualify, it can be for young or old people that we're finding out now. That's really good. And yeah, it's not a exclusively elderly person program to be involved in. I'm sure, of course, it's mainly elderly people. But yeah, what kind of younger people have you seen come in, and what's their response to it?
We've had maybe low 40s to 50s come in and had an injury with the hip and had an emergency surgery. Went to actually Decatur Hospital, had a surgery, came back here, was unable to go up and down the steps at home because she didn't have weight bearing restrictions that she was used to using both legs, and now she could only use one. So got her to where she was a little bit more independent with that hopping and could do the steps. To give her husband some confidence that he could actually assist her. So it took about 12 days, and we got her back home, and she was able to transition home with our Quad County Home Health Services, and they had therapy come in the house after that. And it's everybody. There's no place like home, so getting them back home as quickly as possible at that younger age is actually they appreciate that more. So
Totally. I forget that like a spouse's involvement is really important here. What's their involvement like in the Bridge to Home program? Do they get to be inside and see how what's going on in there, the activities they get up to, and see how they can even help?
yeah, we will teach that we will do family training if it's they get a caregiver, a loved one that's going to assist them a little bit more at home. We'll do training to make sure that they know how to transition the patient, from the bed to the chair, or walk with the patient so that the patient, feels confident and safe going home. Making sure they got, everything medication wise. They understand all of their medicines and when we're supposed to take it. Hands-on training with that, with the loved ones or the caregivers, is a huge part of a rehab, a Bridge to Home program.
Well, that's great. There's training for them as well. All hands are on deck, and wow, that's really great. This is a really great program. This is the Bridge to Home program, and we're almost at a 1 minute left here. And I want to be able to say all of your websites and places people can go for this information.
Yeah. So if you want to learn more about the Bridge to Home program here at Pana Community Hospital, it's on our website at www.panahospital.com. You can click the hospital services and then select the Bridge to Home tab, and everything will be right there. And then you can also call 217-562-6352 and ask for Mamie Campbell, and I'll be there to answer your questions or get you to the right person who maybe, if it's an insurance question, I might need to transition you to someone. But as far as the Bridge to Home program itself, I can probably answer all your questions for you.
Beautiful. Well, Mamie, thank you so much for being on the WTIM Morning Show with us today.
Yeah, thanks for having us.
Absolutely. That was Mamie Campbell from the Pana Community Hospital. She's the Bridge to Home program coordinator, and this has been a great conversation. You've been listening to the WTIM Morning Show here on WTIM's information station.
Your information station, WTIM.